I'll call to order the Green Mountain Care Board's hearing of April 2nd, 2025. We have two agenda items. I think it was just last week we reviewed the rate review affordability guidance, and we had a potential vote noticed. And I believe we're going to take up the vote today. And then we have UVMMC's proposed settlement agreement, and we've noticed an executive session. We had a vote noticed. We've taken the vote off the calendar for today. We may schedule a vote for Friday. We may not. So we're going to see where things go, and we'll schedule it, if we're going to schedule it, probably tonight or tomorrow for Friday, if that's the way it goes. And just for folks, looks like there's some folks from the public here. What we'll do is we'll do the affordability guidance, and then we'll go to the UVM piece. We'll have any board discussion in public, and then I'll take public comment before going into executive session, so nobody has to wait. After we do executive session, I imagine there'll be nothing really more public after that. So if folks want to stay, they can. They can also drop off and have a low likelihood of missing anything. First, I'm going to move for approval of the minutes from March 12th, 2025.
Second.
All those in favor of approval say aye.
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 Aye. The minutes are approved. And I'll also move for approval of the minutes from March 26th, 2025.
Second.
All in favor say aye.
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 Aye. And the minutes are approved. I'll turn to our general counsel, Mr. Barber. Mike, is there any additional information you'd like to give or discuss, or do you want me to open it up to board members?
A couple things I wanted to update you on. Kristen did post the document for public comment. 4 comments were received. Generally speaking, the commenters expressed concern about how high premiums and deductibles already are and kind of a lack of affordability currently. But there's nothing that, no changes to the document that I can kind of take from that that I feel need to be made. And then there's one thing I did want to highlight that I didn't discuss last week when I reviewed the document with you. So in section 4, this is on page 5 of the document, there is a delegation of authority to make updates, revisions, or corrections after consulting with health insurance issuers and the Office of the Healthcare Advocate, which are the parties to these rate review proceedings that this is kind of being implemented for. My thinking there was just, this is new. This is a new thing for us. It's a highly technical document, and I anticipate that there may need to be some tweaks that are made that I can't anticipate at this point. So I'd like to have a way to deal with that efficiently rather than having to bring it back to the full board at a public meeting. So that was my thinking there. And if you agree with that thinking, as part of a motion, any motion to approve, I would just ask that you identify an individual. It doesn't have to be me, it could be one of you, but just identify someone to delegate that authority to. And that's it. I'm happy to answer any questions you have.
Any board member discussion or questions?
I'll just pop in quickly. I just want to say thanks to Mike for working through the issues. I know he spent a lot of time over the last 2 to 3 years working with stakeholders and others to try and find the right approach. And I just wanted to express appreciation for that.
Thank you, Robin. Any other board members?
Maybe with all that appreciation, Owen, we should also delegate some authority to him.
I don't know. I've seen his plate lately, and I don't know that I want to put more on it. Member Lunge, you're in your waning days here. If you support the guidance, would you like to make the motion?
Sure. I move we approve the rate review guidance and delegate authority to Mike Barber for any additions and changes that are necessary moving forward.
I second
Second.
it. Thank you, Tom. And I'll open it up to the HCA.
Nothing from us, Chair Foster. Thank you. We support the guidance.
And I'll open it up to public comment. Seeing none, all in favor of the motion, please say aye.
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 Aye. And the motion carries.
Thank you all.
And I echo Robin's appreciation for Mike's work on this. When we started it, I didn't think it would take that long to get an affordability guidance together. And there's a lot of feedback from a lot of interested parties on how to get it right. So it did take a lot longer than you'd think, which just speaks to how complicated a lot of things are in healthcare. But I'm glad we have it. It gives us a baseline and it helps us really recognize the affordability challenges we have. And hopefully it allows us to continue to make improved decisions. With that, I'll turn to the UVM MC proposed settlement. I'll start. I see there's a couple of UVM folks here. I don't presume you have anything additional you want to share at this time, but I will open it up and give you the opportunity to speak. I see Dr. Eppen is on. Dr. Eppen, if there's anything you want to say, the floor is yours. If not, we'll turn to board discussion.
Nope, nothing to add. Thank you for the opportunity.
Great, thank you. I'll just briefly start. I don't have a lot to say about it at this point, other than we've received a lot of public comment with a lot of different perspectives that we really value. I think I agree with parts of every single one of them. The challenge is synthesizing all of those and making the decisions that we think are best for the whole state. And any of our decisions end up with people, even ourselves, that don't necessarily like the ultimate outcome, but it might be the best we have in that situation. That's not to say that I think this will go through. It's just to say that these are really, really complicated decisions and to recognize that all of our decisions have immense pain and challenges that come from many others with them. And I'm glad and thankful that so many people have spoken up. We've delayed the vote because I'm still going through some of the public comment and I wanted more time for public comment. So that's why we've delayed it. We may do it on Friday. We may not. So I'll turn it to the other board members if there's any comments or discussion of anything board members want to share. Hearing none, I'll turn it to the healthcare advocate for any comments or remarks they may have.
Nothing from us at this time. Thank you, Chair Foster.
Thank you. And I'll open it up to public comment. Julie Wasserman, how are you, Julie?
Okay. I'm fine. Thank you for asking. I appreciate the opportunity to speak. I would just like to add one comment to my previous written comments that I've submitted to the board, and that's in relationship to the $11 million that the settlement would provide for primary care, non-hospital primary care. And I'd like to point out that that group of non-hospital primary care practitioners includes our independent primary care practices. It includes the FQHCs. It includes the free clinics. We have a handful of free clinics, and it also includes Planned Parenthood. according to by state. I appreciated reading by state's written comments. So when you look at all of those primary care practitioners, the $11 million starts to seem like peanuts. And I just want to point out that when you spread $11 million, that's in, nobody really benefits too much in too great a way. Thank you.
Thank you, Julie. And thank you for your written submission. I'll just respond briefly because I don't know if I said it before, but the intent behind the $11 million was really to form bridge funding between the all-payer model and the potential ahead model. So the idea behind it was to have to not have a gap year for that set of primary care providers. So the mechanism I don't think has been defined yet, but that was the intent. Alex Leclerc, Alex.
Sorry, people are trying to call me. So I think our number one issue is we need to diversify our plans. Everyone knows that Blue Cross is the top heavy insurance company and they're taking on a lot of risk, which again, as a business person, I want to give Blue Cross my money and have their plan. I don't want to give it to Cigna, Aetna, Humana, whoever else. But I think that is part of our solution, and we need to encourage those companies to come into the state somehow. I think the number one issue that I have run into when I'm trying to negotiate contracts with those companies is they are terrified of the UVM medical centers pricing. And just full transparency, I use the fee schedule for PT rates as my negotiating tool. And all of them laugh at me and say, "You're never going to get that." And I say, "I know, but can you at least maybe do a quarter?" Because I call all the public companies first before I call MVP and Blue Cross because I know they don't have the money. Which leads me to my other point. I think those other companies are trying to squeeze our system and make it collapse. And they were very close to doing so without us intervening. Sorry, I'm lumping myself in with you guys. Private equity firms are buying businesses in Vermont. And it's across the board. It's in the trades, it's in dental groups. I mean, my mom gets calls from private equity people trying to buy our business all the time. My guess is because they're just going to drop Medicare, Medicaid, and only see Blue Cross and MVP people, which is disgusting. And I think my other big issue, and sorry to the UVM people, I kind of ripped you guys pretty good. I just don't understand why we need 400 million in cash sitting in the health network accounts when people like my little brother are really, really feeling the brunt of having health insurance once they go off their parents' insurance. We're really at a turning point, and I am at the table. I cannot get paid anymore because I'll lose my tax credits. So I will volunteer. I'll do anything to help because we are seriously like hurting big time. And yeah, that's my public comment. Please, and I would encourage UVM, anyone, please ask me any advice that I have. I know I just run a small PT business. I do not run a hospital. I have no idea what that even looks like. I just really want the best for our state and to have our young people stay in the state. And when I was talking to one of my friends on Tuesday night or Monday night, actually, she's a nurse in Boston, and she just said, "Have UVM call me." like, please use the nurse database that they have, and call all the nurses who graduated from UVM and see if they're willing to come back. And lastly, the UVM PT school is absolutely amazing. Over half of my employees are UVM PT grads. They turn out amazing PTs. And we really need the medical center to keep those programs to help us private providers provide care in the community. And yeah, I really want this to succeed for all parties. I just it just felt like, I know you guys worked a lot on this. I just know UVM can do more, and I just please ask, get them a little bit more, because I don't think 11 million is enough for all the FQHCs, all the private practices across the board. Please ask them what their budgets are and what they are going to need, because there's no help coming. So thank you for my comment. And again, I'm an open book. Please reach out to me if you need me.
Thank you, Alex. And it's been nice to have you participate and pay attention to these and comment. And I will just say that we echo those acute concerns about the healthcare system and the FQHCs. I mean, I'm just going to say it out loud that it is a bit of a domino effect if we lose one of our FQHCs in a particular area. And UVM recognizes this as well. And one of the biggest threats to them are the rate increases. And Blue Cross has said that it could be a 15 or higher % rate increase again, which I know will impact your practice, but it will really create a significant financial strain that may not be something some FQHCs can get over, right? A 20% rate increase on potentially one of their largest expenses is really difficult if there's federal changes that impact them as well. So something that we are really, really concerned about is how do we drive down these rate requests this year? If they're going to be 15 to 20%, things are going to get consolidated, things are going to back up in hospitals, and we will hurt our demographic goals that you alluded to. Private equity, a number of places will have no choice but to sell to private equity. And you're right, we're seeing more and more vet practices, dental practices throughout the state. So we do need to come together right now, really quickly, to find some immediate solutions. And this UVM thing is important and it's part of it. Maybe it's not the right solution, but there's a lot more that needs to be done regardless of where this lands. Ms. Barnard, Jessa, how are you?
Hi, thank you. And you actually said just what I was part of what I was about to say. I'm the executive director of the Vermont Medical Society, and we did submit written comments. So I'm just going to keep this very brief and high level to say we really appreciate the work that all the parties put into coming to this settlement agreement, and we do think the 11 million for primary care is particularly important right now. I know the board is aware of this, but just to highlight that it is not going to solve all the base funding needs, but we're facing an acute crisis in 2026 with the gap between the end of the all payer model and what we still are working towards for potentially joining the AHEAD model in 2027, which would bring more per member per month payments to primary care practices. And so in this 1 year need, this would almost entirely fill that gap, along with the governor's proposed budget to fill a gap for the Blueprint program. So we really appreciate seeing these pieces of the puzzle come together, at least for this really immediate 1 year need. And this could be really important to keep practices afloat until we get to 2027. So thank you. And we do support moving forward with this $11 million investment in primary care. Thank you.
Thank you, and thanks for your written submission. Just to set expectations for anyone who's paying attention, that AHEAD is not a done deal in this state. I wouldn't count that money is going to be there, or that's going to happen. There's been an administration change. The state is communicating with them again, and we'll see where it lands. But I wouldn't necessarily say that is done. There's more evaluation and more negotiation that's happening. Walter, how are you?
Hey, Owen, how's it going?
Could be better.
Why? How could you? Isn't it a nice sunny day, Owen?
It is.
Ready to go,
Yeah,
Spring
ready.
is on the way, supposedly.
Love is in the air,
Nothing's wrong.
Walter.
Nothing's wrong with the health system, right, Owen? I just want to, there's nothing more I could add to all the comments that have been spoken here. I just want to say thanks for postponing the vote by in order to read all of the public comments. I noticed that. That was pretty good.
Thank you. I mean, we really do. I would venture to guess that every single board member reads every single public comment probably we ever get, actually. I would be surprised if I've ever missed one.
I read a majority of them too.
Yeah. They're impactful. Any other public comment? Okay, hearing none, we are going to see if there's a motion to go into executive session. I'll make the motion. I move to make a finding that premature general public knowledge of pending civil litigation to which the Green Mountain Care Board is a party, and 2, confidential attorney-client communications would clearly place the board at a substantial disadvantage.
I'll second.
Second.
All those in favor of the first motion?
Aye.
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 Aye. I also move that we enter into executive session pursuant to 1 VSA section 313 A1E and F for the purpose of discussing pending civil litigation to which the Green Mountain Care Board is a party and seeking counsel from the Care Board's attorney staff. Attendance at the executive session will include the board members, the Care Board's counsel, and necessary Green Mountain Care Board staff.
Second.
All those in favor, please say aye.
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 Aye, and the motion is approved. I'm going to guess that the executive session could be over an hour and a half long, maybe 2 hours. I don't think we'll have much business in the public session after, so we'll put up a notice of when we'll come back, but I don't think there'll be a whole lot. So we'll adjourn this meeting and we'll come back in about an hour and a half to 2 hours. All right, we can resume our public meeting. I will call for any other public comment on the topics today. Is there any public comment via raise the hand? Any new or old business for the board? And I will move to adjourn.
Second.
All in favor, say aye.
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 Aye. We are adjourned. Have a nice day.